going to start by, setting the stage a little bit with the cancer formation. So you can learn a little bit about cancer forms, simplifying it a little bit. Then we can go through some risk factors for breast cancer, and then ending with strategies to reduce your risk. And my goal is to help you learn the why behind the do. I think we're all told eat your fruits and vegetables, but the question is why. So I'm hoping that as you learn the why behind the do, you get empowered to do what we should all be doing. So many of you know breast cancer is the most common diagnosis of cancer among women worldwide, and certainly in the United States. Men do get breast cancer, but the numbers are so low, it doesn't even make this breast cancer facts and figures list. So today I'm focusing on female breast cancer, and it is the second leading cause of death for women, cancer-related deaths. Most of you are very familiar with this number. 1 in 8 women in their lifetime will develop breast cancer. Last year, there was about 290,000 new cases of invasive breast cancer diagnosed, and then over 50,000 new cases of the non-invasive cancer, DCIS. So did you know that most of us have small cancerous tumors in our bodies called microtumors? When I learned about this many years ago, I was fascinated. And studies luckily show that lifestyle and nutrition have a direct effect on whether these tumors are eliminated or they're able to develop into a clinically significant cancer. One study by Folkman, they did autopsies on women ages 40 to 50, and about 30% of women harbored non-clinical breast cancers in their breast tissue, and even women as young as 20. So the risk starts early. Epigenetics is really important to understand if we're talking about our risk for breast cancer. It's kind of the golden key. So it accounts for reversible changes in DNA expression. So this is not a genetic mutation, but it's how our genes are expressed. And epigenetics allows us to have control over our outcome through choices we make in regards to diet and lifestyle. So the DNA sequence stays the same, but we can change the expression of tumor suppressor genes or oncogenes. So tumor suppressor genes are normal genes that help keep cancer at bay, such as the BRCA gene, and oncogenes such as HER2/neu normally have normal function, but sometimes they can be overexpressed and cause cancer promotion. Since only 5 to 10% of our breast cancers are caused by genetic mutations, and an additional 5 to 10% are familial in origin, that means over 80% of breast cancers are related to environmental exposures and lifestyle choices that we make, including diet and exercise. Familial breast cancer means that you have a very strong family history, say of breast cancer or other cancers, but you test negative on your genetic testing. You still have inherited risk through epigenetics. It's about gene expression. So everything we do ultimately affects the regulation of our genes, either good or bad. I love this slide. This slide supports influence of lifestyle choices on cancer development. So in the green, this shows breast cancer incidence in Japanese women who were born and raised and still living in Japan. The orange shows Japanese women that were born in Japan, but then they moved to Hawaii later in their life. So their risk of breast cancer increases, but it's not as high as those that were born, Japanese born in Hawaii, living in Hawaii. So it kind of shows the effect of the Western lifestyle and the standard American diet on cancer risk. And you can see living in Japan with their healthier lifestyle, the risk is much lower. But as they adopt a Westernized lifestyle, stress, kind of faster paced life, poor diet choices, their incidence goes up. So cancer, to be simplified, requires initiation, promotion, and progression. And I'm going to go through this so you understand cancer development a little bit better. This is over a long time too. You can see 1 to 40 years. So the step 1 is initiation. So initiators cause irreversible DNA mutations. Initiators are aging, chronic inflammation, viruses like HPV, radiation, carcinogens, toxins, smoking, alcohol. I'm sure you're familiar with many of those. So once a cell has gone through initiation, it's always susceptible to the next step called promotion until that cell dies. The initiated cell can remain dormant until it's stimulated by promoters. And maybe some of you have been diagnosed with atypical hyperplasia or lobular carcinoma in situ on breast biopsies you've had. These only represent about 5% of changes that we see on breast biopsies, but these are initiated cells, so we take them very seriously. And chemoprevention can halt this initiation. Phytochemicals also are very powerful anti-cancer chemical compounds. They're present in plants in our diet, and they can block the initiation process, such as ellagic acid from any type of berry, with raspberries being the strongest, walnuts, sulforaphane in broccoli, indole 3-carbinol in cabbage, and disulfide in garlic. So we'll talk a little bit more about that later, but I just wanted to see how powerful phytonutrients are. So the next step would be promotion, and this is over long term. It can happen over 1 to 40 years. And this is where the precancerous cells start to divide and accumulate. Promotion requires repeated and prolonged exposures to promoting stimuli, and it can be halted or even reversed. So there's hope there. Promoters are toxins, hormones such as estrogen, chronic inflammation. And the promoters are often specific for the tissue where the cancer is developing. So like the known hormone driving effect of estrogen in breast cancer. The standard American diet is a promoter, but healthy food choices and certain nutraceuticals can serve as anti-promoters. And if we choose healthy choices, 3-4 times a day, almost every day for many years, good things can happen. But on the reverse side, if we make poor choices many times a day over many years, cells can get promoted with the poor lifestyle choices. So progression would be the next step, where promoters and the proper tumor microenvironment promote progression of the cancer cells. This usually happens when there's alterations in those tumor suppressor genes or the oncogenes. Aging accounts for some of the progression. Inflammation supports a tumor microenvironment that supports its growth. And your lifestyle choices have a high influence over the tumor microenvironment. The chronic inflammation can support angiogenesis, where the cancer cells make blood vessels to support growth and nutrient access. So your lifestyle choices can affect this either in a positive or a negative way. Once the cancer accumulates enough changes, it kind of grows free from restraint. And at this point, it grows fast, and it does have the ability to metastasize. So just an example of phytonutrients that can help this stage progression, quercetin, can affect all 3 stages, and it's found in apples, honey, onions, and citrus fruits. So everything we eat can have a positive impact. So here's just an overview again of this. So the cancer development, on average, it takes 9 years for a 5-millimeter breast cancer to develop. So it's a long process. The cell gets initiated, but you have the ability to block the initiation through different phytonutrients available in our diet. Same with promotion, happening over a long time. Things like soy and green tea, curcumin, can block the promotion process. The raspberries that have the ellagic acid can block the angiogenesis. And so we have a lot of opportunities to halt cancer formation. This is what I call the cancer triad. So the three main components is going to be chronic inflammation, aging, and then genetics or epigenetics. And since most women diagnosed with breast cancer or at risk for breast cancer don't have any genetic mutations, epigenetics, as we talked about, plays a big role. The diet, environment, and lifestyle choices can work together to either promote or prevent the cancer formation. So why aging? Aging represents a cumulative lifetime exposures. So they kind of build up over time: UV exposure, radiation, lifestyle choices. Our cells actually begin to malfunction, and normal protective processes such as senescence, apoptosis, where the body is able to either cause cell death in cells that are aging and aren't having normal function anymore, or at least put them into kind of a hibernation state. And then other processes that are more complex, like methylation of telomeres. But basically, we have a malfunction in our normal protective processes in our cells. We also have a decreased immune function, and our bodies absorb less nutrients as we age. A lot of aging people have poor sleep, and that affects our immunity. And then you can have loss of muscle, which also plays a role in our health. So when I talk about chronic inflammation, I want to make sure you understand the difference between acute and chronic inflammation. Acute inflammation is when you get an injury. You know, maybe you get a cut or a burn and the area gets red and swollen, maybe painful. That's an acute process. That lasts over a certain period of time and eventually goes away. But chronic inflammation is a slow systemic inflammation that happens and over a long time can cause a number of diseases, including cancer. So causes of a low-grade systemic chronic inflammation, chronic infections like HPV, physical inactivity, obesity, diet choices, chronic stress, poor sleep, and xenobiotics, which is like toxin exposures. The consequences, as I mentioned, are many different diseases, and one is cancer. So chronic inflammation, the importance is that it promotes carcinogenesis, as we saw in the initiation, progression, and promotion sequence of tumor formation. And as an example, obesity causes both in-breast and whole body systemic inflammation, and this contributes to the development and progression of breast cancer. Inflammation supports a tumor microenvironment that allows our cancer cells to flourish. So breast cancer risk factors, inherited genetic mutations and familial risk only accounting for 5, maybe max 15% of the breast cancer. Lifestyle choices and environmental exposures are going to account for the remaining 85 to 95%. We like to divide the risk factors into modifiable versus non-modifiable. So non-modifiable risk factors, one of the biggest risk factors is just aging. So if you have excess chromosomes, you have breast tissue, and you're aging, you're at risk. Family history of breast cancer, Ashkenazi Jewish heritage, genetic mutation, radiation for Hodgkin's lymphoma, younger than age 30. Overall, our increased lifetime exposure to estrogen puts us at risk. So women that have early menarche or late menopause just have a longer estrogen exposure and are increased risk for breast cancer. And then I mentioned before, abnormal cells found on, say, a biopsy for some patients like LCIS and atypical hyperplasia. and then dense breast tissue. So those are some of the non-modifiable risk factors. So aging, you know, as we age, as a woman ages, her risk for breast cancer increases. So when you're in your 30s, the risk is very small, 1 in 1,000. I mean, we do have women in their 30s get breast cancer. It's just not as common. And you can see at age 50, 1 in 48. And if you live to 90, if you're standing in a room with 7 other women, and so one in 8 would have had or have a diagnosis of breast cancer. So lifetime risk 1 in 8. And that's why so many things we do as we get older matter more than, say, when we're a teenager. As our cells age, our risk increases because our aging cells are more susceptible. I wanted to make sure you understood absolute risk versus relative risk. And I just had this smoking slide that I copied. But absolute risk is a definitive number. So let's say female non-smoker, her risk for breast lung cancer is 1.3%, compared to a smoker whose absolute risk is 11.2%. If we're talking relative risk, non-smoker versus smoker, the smoker has an 8-time higher risk, or a 1.8 relative risk. So if you have an 8-time higher risk, it can sound like a lot, but you can see here, 11.2%. I mean, it's high, but it's not, maybe not as high as you think with an 8-time higher risk or a 1.8%, 1.8 relative risk or an 80% increased risk. And here are some risk factors that are show the relative risk. So I just want you to take a look at this. You can see aging, high relative risk. BRCA mutation at a young age, very high. Hyperplasia, very high. LCIS. But those are less common, except for aging. We're all going to age. But the other ones, though they're very high risk, in family history, less common. Most women diagnosed with breast cancer don't have a family history. They don't have genetic mutations. So down here, you can see relative risk is lower with different risk factors, but it's all additive, so it adds up over time. For every 10% of processed food and sugary drinks of your diet, get a 12% increased risk. So this just shows the family history, giving you that relative risk. So it is impactful if you have family history. We definitely take that seriously, and you will be at increased risk for breast cancer. So the most common known or mutations that patients are familiar with for increasing risk of breast cancer are the BRCA1 and 2 genetic mutations. There's 11 other genes that increase a woman's risk. But I just wanted to point out that Ashkenazi Jewish heritage, if you have that heritage, you're more likely to carry the mutation. So in the general population, about 1 in 400 people will carry the BRCA gene mutation. But if you have Ashkenazi Jewish heritage, 1 in 40 will carry that mutation. Lifetime estrogen exposure, of course, increases risk. Just prolonged exposure to hormones, estrogen and progesterone. Prolonged lifetime exposure would be early onset of menstruation, age 12 or younger. Late onset of menopause, age 55 or older. Older age at first birth or never having given birth. Pregnancy and breastfeeding do reduce a woman's number of menstrual cycles and therefore cumulative exposure to hormones. But interestingly enough, within recent childbirth, there is a short-term increase in breast cancer risk that lasts for about 10 years. I touched on lobular carcinoma in situ earlier. This is initiated cells. Women that have this diagnosis in their biopsy carry a very high risk for breast cancer, cumulative at 20% at 15 years. So women that have this finding sometimes will choose to take chemoprophylaxis like tamoxifen to prevent the risk and adopt early kind of high-risk screening protocols with supplemental screening. Same for atypical hyperplasia. These are initiated cells, relative risk of 5. And after 25 years after diagnosis, about 30% of women will develop breast cancer. Dense breast tissue, relative risk of 1.8, so 8 times that of somebody without dense breast tissue at risk for breast cancer, or 80% increased risk. And the question is why? And that's because women with dense breast tissue have a higher proportion of lobules and ducts, basically the elements that breast cancer forms in. They have a higher proportion of supportive connective tissue, which provides a supportive tumor microenvironment for cancer to grow. The dense breast tissue represents higher levels of circulating hormones. So women with dense breast tissue are 4 to 5 times more likely to get breast cancer than women with fatty tissue. And it does affect premenopausal and postmenopausal women. It contributes up to about 16% of breast cancers. And if you have dense mammographic areas, it confers an excess breast cancer risk for about 10 years. I mentioned chemoprophylaxis, so basically risk modification, reducing your risk by taking something like tamoxifen for women that are very high risk or have high risk biopsy results. Modifiable risk factors, obesity, hormone replacement therapy. I guess you could modify when you have your first child, but we don't recommend that. Breastfeeding, some women could choose to breastfeed or not breastfeed, and some women can't breastfeed. Lifestyle choices, such as food choices, processed food, smoking, alcohol consumption. Some women are just estrogen dominant. They have a lot of fibroids in their uterus, fibroadenomas in their breast. That represents estrogen dominance. That puts you at increased risk. And modifying mean maybe speaking with someone about estrogen, kind of hormone balance. How do you do that? Exercise and emotional stress, of course, we can hopefully learn to modify. So let's talk a little bit more about obesity. About 42% of adult Americans are obese. And that's probably just due to standard American diet, busy lifestyle, economic challenges, or larger portion sizes. But it does play a significant role for inflammation and the pathogenesis of breast cancer. The inflamed fatty tissue within the breast basically promotes breast cancer. It's associated with elevated levels of pro-inflammatory mediators. There's enhanced expression of the aromatase for estrogen production. So you have higher circulating levels of estrogen, and also insulin resistance, which increases insulin-like growth factor, which also promotes breast cancer. So I just wanted to look at absolute risk again. So let's take an example. There's a 50-year-old female. Her baseline risk is 1 in 48, just for the aging risk of 2.1%. And if we add in some risk factors, so first birth after 30, which is not uncommon, that's a 1.8 relative risk, dense breast tissue, mother who had postmenopausal breast cancer, processed foods, and 2 drinks per day. If we add all the risks together, her risk increases to 16%, which is pretty substantial. Another example, 65-year-old female, her baseline risk 1 in 23 or 4.3%. Adding in some other risk factors, first birth after 30, dense breast tissue, maybe a little overweight, using some combination hormone replacement therapy, eating some processed food, having a couple drinks a day, take the edge off at the end of the day. her calculated risk for breast cancer increases to 29%. Now, these are key concepts that I think can positively impact our health: moderation, variety, and synergy. So moderation kind of comes back to that acute versus chronic exposure. Our bodies, they're meant to handle acute exposures, you know, acute injuries, a toxin here and there, different environmental exposures. And we have, you know, we have ways to fight those acute exposures. But when we're exposed to something chronically every day for many years, our body tools to fight that kind of turn harmful. And the chronic exposure makes our protecting mechanisms kind of working all the time, causing chronic inflammation and causing us harm. So chronic exposure happens when we don't practice moderation. So some food compounds that are healthy, such as soy, which is a great choice for breast cancer reduction, but it can be kind of toxic when it's overconsumed. So when you have too much of it every day, it's actually called an anti-nutrient, and we can lose iron absorption, magnesium absorption, and it interferes with absorption of other minerals. And then, you know, even the healthiest food, each individual food doesn't contain the full spectrum of the compounds we need for great health. So focusing too much on a small number of healthy foods can deprive us of critical anti-cancer nutrients. So we want to focus on variety. So moderation kind of promotes variety. If we practice moderation, we free up space in our life for variety and hopefully the healthy kind. I really view food as medicine, and variety is very important in food. And if you eat different kinds and colors of food, they contain different medicines or chemical compounds and phytonutrients that are very important to us. So eating a wide variety of foods allows the body to receive all the healthy nutritional benefits we need to live in an anti-cancer state. Variety promotes moderation. Variety reduces the risk of chronic exposure to toxic substances like unknown pesticides on produce. And a variety in the foods we eat also helps prevent chronic exposure to good substances that are detrimental when overconsumed. Variety can also promote synergy, where eating a variety of healthy foods rather than a limited diet can lead to anti-cancer synergy. The combined benefit of different food or medicines is greater in their additive effects. I always recommend eating a variety salad almost every day. So synergy, this is the combined effect of 2 or more health choices that can be greater than expected. So instead of 3 + 3 + 3 = 9, it's synergistic. It gives you 3 × 3 × 3 is 27. So synergy can work for the better to maximize your health, or for the worse to maximize disease. Changing one lifestyle choice or habit is good, but changing 2 or 3 or 5 or more bad habits to good habits offers a synergistic improvement in your health. Nutrients do affect each other. So magnesium influences the effects of iron, protein affects zinc, vitamin A acts differently when paired with vitamin D. So everything can work together. And if we're looking at different phytonutrients that fight cancer, say there's curcumin, and that can act synergistically with quercetin, resveratrol, and green tea for a anti-cancer powerhouse cocktail. Whole foods provide synergy in the nutrient level and absorption that vitamins and supplements can't provide. And Dr. T. Colin Campbell, who wrote the China study, did a study that compared vitamin C supplements to an apple. So just 2 apple slices were found to have the antioxidant strength of 3 vitamin C supplements of 1,500 milligrams. But when they actually analyzed the apple itself, the amount only came to 6 milligrams. So there's synergistic, there's a synergy happening in our whole food that we can't get through supplementation with vitamins and supplements. So I think it's really important for us all to really take an honest look, what is our food intake like? Is it lean more towards the standard American diet that just tends to be high in bad fats, highly processed, a lot of added refined sugars, high in processed toxic oils, and genetically modified? That's kind of eating out of boxes, crackers, chips, cookies, things like that. As compared to an anti-cancer diet, which is really whole foods, healthy fats and oils. It's very high in fruits and vegetables, and there's limited meat and dairy. And if you're going to choose meat and dairy, then I recommend grass-fed beef, which is higher in omega-3s and omega-6. Omega-6s are pro-inflammatory and cancer-promoting. And dairy, really concentrating only on fermented dairy, so yogurt, sourdough bread, things like that. So again, the power of food is medicine. I do recommend buying organic and non-GMO. The pesticide glyphosate promotes aggressive breast cancer formation. So I wanted to touch a little bit about vegetable oils and cancer. So vegetable oils contain a high percent of polyunsaturated fats. And these come in two kinds, omega-6 and omega-3. We need both. Both are essential fatty acids. We need to get both from our diet. And though omega-6 is pro-inflammatory, it's still important. It's just that the standard American diet has an unhealthy ratio between the two. The standard American diet provides omega-6 over omega-3 at a 10 to 50 to 1 ratio. And most of that's due to vegetable oil consumption. And most of the vegetable oils that we use contain more omega-6 than omega-3. I've seen vegetable oils in ice cream labels, cookies, crackers, breads. So after digestion, the omega-6 becomes pro-inflammatory mostly, and omega-3 is anti-inflammatory and anti-cancer. And we want to try and reduce our ratio down to close as 1 to 1 as possible. And breast cancer has been associated with high consumption of vegetable cooking oils, resulting in an imbalanced ratio of the two classes of PUFAs. And it's not the oil itself, it's how the oil is processed. So what happens is that the PUFAs are highly unstable compounds that are easily oxidized, and they become toxic during processing, storage, and use, such as frying. Toxic byproducts are produced, and they're highly reactive, creating free radicals in our body, which cause DNA damage, kill healthy cells, basically contribute to initiation, progression, and promotion of the cancer. There was this interesting study at the University of Illinois that showed that the compounds in basically reused cooking oils appears to trigger epigenetic and biochemical changes that hasten progression of late-stage breast cancer to promoting tumor cells growth and proliferation. Sugar becomes important, added sugar, when we talk about sugar and cancer. So added processed and refined sugar increases the risk of breast cancer. Sugar contributes to breast cancer risk by contributing to that chronic systemic inflammation, increasing circulation of insulin growth factor, and increasing insulin and contributing to insulin resistance and obesity. There is added sugar hiding about 74% of packaged foods, and added fructose is probably one of the most dangerous kind. So there's over 100 names for sugar when you're reading labels in your food, and just happens to be a slide that shows 75 different names for sugar, basically. Now, meat intake is associated with cancer, and it's probably two reasons. One, most of the meat we produce is raised on unhealthy grains, and they're very high in omega-6, which are those pro-inflammatory cancer-causing substances, as opposed to grass-fed beef and free-range chicken, which is higher in the omega-3 anti-cancer compounds. So I think that's one reason why meat is connected to cancer. Number two is maybe the way we cook meat. So grilled and charred meat, there's changes in proteins that basically form cancer-causing compounds in that char when you grill it. And it is associated with breast cancer risk. So, and it's the char in the meat that indicates the risk. So if we're going to choose to eat meat, we want to choose grass-fed, free-range chicken, grass-fed beef, free-range chicken, and we want to try and avoid that char if we can. So again, just pointing out phytochemicals in our foods contain powerful anti-cancer compounds, and we'll go through this a little bit more in detail. So I love this slide. This is where they took extract from the foods and put them in a dish, like a petri dish, with different breast cancer cells. And they looked at cell growth or proliferation in reaction to the different extracts from these different common foods. And you can see here, no cell growth, just garlic, leek, onion, Brussels sprouts, cauliflower, cabbage, broccoli. Just amazing anti-cancer compounds in those foods. So try and sprinkle a lot of green onions or add garlic to every meal. I mentioned before that variety in our diet is really important, and it's really important piece of our nutritional armor against cancer. So food really can be medicine, and different kinds and colors of food contain different medicines. Let's talk about soy. So studies have shown that soy consumption has about a 30% risk in reducing breast cancer, 30% reduction in the risk of developing breast cancer for women. It also has about a 30% risk for decreasing recurrence for women. So multiple studies have shown soy food to reduce the risk of breast cancer. There is some evidence that maybe the greatest risk reduction is when soy was consumed in premenopause. There's three main phytonutrient components of soy, 3 isoflavones, genistein, diadazine, and glycitin. So genistein is considered to be most potent of the isoflavones, but they're all important. I do recommend buying non-GMO and organic. And there's about a 60% risk reduction for every 10 milligrams of isoflavones intake per day. And the traditional soy foods contain about 20 to 30 milligrams of isoflavones per serving. So that would be about a cup of soy milk or a half a cup of tofu. You want to focus on whole and fermented soy food, not processed soy. So tofu burgers and tofu hot dogs don't count. They lose most of their isoflavone component, and the processing of them really changes them more into a toxic chemical. Black and green tea have powerful components that fight cancer. So there was with 5 or more cups of green tea or black tea per week, compared to no intake, there was about a 15% lower risk of breast cancer. So black tea has catechins and other isoflavones that are anti-cancer. And this is just a little graph to show you exactly what black tea is doing. It promotes cancer cell apoptosis, so that's cancer cell death. It can inhibit the blood vessel formation or angiogenesis that the cancer requires to grow, and inhibits cancer cell metastasis, supports appropriate immune response, and supports systemic detoxification. So green tea is also very powerful anti-cancer. It works a little bit different. It contains EGCG, which is the powerful component, but it also inhibits angiogenesis, suppresses tumor, promotes tumor suppressor genes, their function, like BRCA, promotes tumor cell death, inhibits tumor growth, inhibits tumor metastasis. It can act as a chemoprevention, stopping the initiation phase, and it's highly anti-inflammatory. Fiber is very important when we're talking about cancer prevention. It allows our intestinal microbiome to ferment fiber to short-chain fatty acids like omega-3s that are really important for anti-inflammatory immune support. And the fiber reduces the production of carcinogens in our intestines. For breast cancer specifically, it helps us control blood sugar, decreasing the IGF promotion, and it decreases estrogen levels. Women who consumed the highest amounts of fiber compared to women that consumed the least amount had about an 8% lower risk of breast cancer. You can see in this graph. I like this table because it just shows you that really we don't want to hone in on one food. We want to focus on many different foods because all whole natural food has some type of benefit as far as anti-cancer goes. So in this table, you can see that just green vegetables, breast cancer, postmenopause reduction, risk reduction by 44%, lignans such as lentils, soy, breast cancer risk reduction, menopausal 28%, green vegetables 30%, and postmenopausal breast cancer with vitamin D supplementation 35%, and blueberries even working against estrogen negative breast cancer, reducing the risk by 31%. Nuts and seeds are really powerful anti-cancer foods. So ellagic acid found in walnuts and peanuts promotes tumor death. It actually does stop the angiogenesis, the formation of blood vessels to the cancer. It inhibits tumor growth. Flax seeds are probably the most powerful out of all the nuts and seeds, and they're very specific to breast cancer risk reduction. Again, inhibiting the angiogenesis and tumor growth. It's 1 tablespoon a day decreases risk of breast cancer by about 30%, and it does decrease the risk of recurrence for women who have already had breast cancer. Mushrooms are also very powerful anti-cancer foods. There was a study done in Western Australia of 2,000 Chinese women. About half of those women had breast cancer. And ultimately, what they found in the study was that women that ate 1 mushroom per day compared to women that didn't eat any mushrooms, they had about a 64% less likely chance to develop breast cancer. And dried mushrooms reduced the risk by about half. Eating mushrooms and regular consumption of green tea had a greater benefit of reducing breast cancer risk by about 89%. So why? These mushrooms have aromatase, natural aromatase inhibitors, just like the medication that people are put on, aromatase inhibitors such as anastrozole. Pomegranate also is a strong aromatase inhibitor. The types of mushrooms you want to eat mostly are the white button mushrooms and portobello mushrooms. They have the strongest anti-aromatase activity. And the mushrooms contain specialized lectins that recognize cancer cells, and they prevent cancer cells from growing and dividing. You don't really want to eat them raw. You know how sometimes we cut up those button mushrooms and put them in our salad. Those do contain some toxins, and so the best way to enjoy them is cooked and daily if possible. So this is just another visual look at the benefits of edible mushrooms. Additional components in them are the terpenoids and the polysaccharides that, again, you can see are powerful anti-cancer components. We looked at that graph with the garlic, leeks, and onions. So specifically, you can see all of the things they do: inhibit, promote cancer cell death, suppress cancer growth, they detoxify, they decrease the hormone effects of estrogen, they block the carcinogenic effects of a lot of initiators, they promote an unfavorable tumor microenvironment, so cancer has a hard time growing. They're strongly anti-inflammatory, highly support our immune system, and they're antioxidant. I'm sure you're all aware that cruciferous vegetables are very powerful. We saw that graft, cabbage, broccoli, cauliflower. These contain specific plant enzymes that initiate the breakdown of glucosinolates into biologically active compounds called indoles and isothiocyanates. You need to chew, cut, or blend the food for the important components to be active, and cooking them at high temperatures destroys the important components. So you want to likely cook or steam them. The compounds stimulate detoxification enzymes. They eliminate carcinogens before they have a chance to damage your DNA. And you want to aim for about 3 to 5 servings per week. And again, just another visualization showing you the different components: sulforaphane, indole 3-carbinol, I3C, diol disulfide, all working to prevent cancer from taking hold. I wanted to point out broccoli sprouts. These are a superfood, and they have such a high amount of sulforaphane that one study showed that just 1 1/4 cup of the broccoli sprouts was able to kill cancer cells. So it's not too much, you know, using those a few times a week in your salad or on your different foods that you're eating. Ellagic acid is really powerful. You can find it in raspberries. They are the berry with the highest amount of ellagic acid, but also walnuts and pecans, pomegranates. Again, just a variety of anti-cancer ability, such as decreasing insulin growth factor signaling, which promotes cancer growth, reducing hormonal signaling for cancer, suppressing cancer cell growth, promoting cancer cell death. Carotenoids also contain multiple anti-cancer benefits, protecting our cells from DNA damage, again, the initiation process. So you can see that there. And citrus fruit, very important, again, for chemoprevention, inhibiting angiogenesis, limiting effects of hormones, promoting cancer cell death. So I'm just trying to show you that every food matters, even spices. So spices inherently have high anti-cancer properties, preventing angiogenesis, inducing apoptosis, basically all working to promote cancer cell death. So we looked at this slide before, again, just showing you the benefits of the different components in the foods we eat, all the phytonutrients that are very powerful against cancer. And you have a chance, you know, even with initiated cells, we can make a difference with the food we eat. During promotion, we can reverse that process. I want to make sure that we talk a little bit, remember that stress, so chronic stress in our life is really powerful. It can damage our bodies. We have to learn to find a way to de-stress and find balance in our lives. The cancer cells, they actually express adrenaline receptors. So chronic stress promotes cancer formation, and studies have shown that it promotes metastasis. It's the chronic release of glucocorticoids and catecholamines that cause DNA damage. They promote a favorable tumoral microenvironment. They promote tumor angiogenesis. Chronic stress, of course, suppresses our immune system, and it doesn't function as well in response and surveillance. And it decreases our tumor suppressor gene activities. So the BRCA gene that normally functions as a tumor suppressor, we have other tumor suppressor genes. So basically, we really want to work hard to take the time to be able to de-stress and find balance in our lives. Exercise is also really important. Moderate exercise, so basically 150 minutes a week, just moderate level activity, reduced breast cancer by 18%. And women who exercise after a breast cancer diagnosis can decrease the risk of recurrence by about 40% with consistent exercise. It doesn't have to be a lot, and it can be more moderate intensity. So the benefits is that it decreases estrogen levels. Exercise lowers whole body cancer-promoting inflammation. There's actual suppression of cancer-promoting NF-kappa B. Obviously provides mental benefit and stress relief, and it strengthens your immune system. We are surrounded by toxins. This one peer-reviewed journal, Environmental Health Perspective, identified 102 chemicals linked to breast cancer. So we want to work to kind of decrease our toxin exposure as much as possible. So the sister study, this was about hair dye by the NIH, and it showed that regular use of permanent hair dye, so every 5 to 8 weeks, showed that women that used the hair dye were 9% more likely to develop breast cancer than women that didn't use permanent hair dye. And African American women were specifically at a great increased risk of 60% for breast cancer development compared to 8% increased risk for white women. So this is permanent hair dye that would be on your scalp, kind of soaking in, a little bit different than, say, highlights where it's not as close to your scalp usually, and non-permanent hair dyes didn't have any impact on cancer development. Unfortunately, alcohol is basically a toxin, and it's important to limit our alcohol consumption. There's a linear association of risk with each drink that we take. And women, compared to women who didn't drink at all, women who had 3 drinks a week had a 15% higher risk of breast cancer. One study showed 30 to 50% increased risk of breast cancer from 1 to 2 drinks per day. And even women who drank less than 1 drink per day, there's still an increased risk of breast cancer compared to non-drinkers. So I think this is where, we want to talk about moderation, trying to limit our alcohol intake to, I would say, less than 3 drinks per week. And this just kind of shows you what a standard drink is. So we're surrounded by plastics and toxins. So xenoestrogens are mostly found in plastics, but also in perfumes and fragrances. They have specific estrogen-like effects in the body. And so they basically imitate estrogen and can increase the toxic burden, cause estrogen dominance, and they're found in numerous things that we use every day, even in the bleached feminine hygiene products. The most common xenoestrogens are going to be the phthalates. They're in fragrances and different personal care products, parabens in many beauty products, bisphenol A or BPA in plastics, pesticides, and some food preservatives. So I think the best thing to do is just try and minimize your exposure. So food, that kind of comes down to eating, mostly organic if you can, and if you can't, consider peeling the non-organic fruits, although a lot of the benefits are in the skins of the fruits, a lot of the phytonutrients. Of course, I think most people buy hormone-free meat and dairy products now, but I recommend avoiding most dairy. Plastics, now I do this. I try not to use plastic as much as possible. I never microwave my food in plastics. I use glass containers. I try and minimize the use of plastic wrap. And I certainly don't drink out of bottled water unless I have to. And just be aware, don't let your bottled water, if it's sitting in your car getting hot over days, just throw that out, because the plastic actually is able to seep into the water even more when it gets heated up from the sun. Household products, again, chlorine, considering buying chlorine-free products if you can find them. There's a lot more available nowadays than there used to be. And for health and beauty products, there's a lot of beauty products now that are safer, paraben-free. Like if you shop at Sephora, clean at Sephora. So just kind of minimizing your exposure and being aware of how much exposure we have. They just did this study where they now have found microplastics in human blood in about 80% of the people tested. So that's how much plastic we have in our life. Those are initiators that we get exposed to every day. So we want to use food to fight that initiation. Another important anti-cancer compound is vitamin D. So vitamin D has multiple effects. It inhibits cell proliferation, enhances cell differentiation, causes that cancer cell death, inhibits the angiogenesis, and it activates our immune system. Women that maintain their vitamin D levels at 60 nanograms per mil, they have about an 80% reduction in breast cancer incidence. And I have to say, you know, we use so much sunscreen nowadays, diets are poor. The large majority of women that I see in my office when I test them, their levels are pretty low. They're around 30 very commonly. So I would recommend getting your levels tested and then doing supplementation to get yourself to the optimized level of vitamin D of 60 nanograms per mil. And again, I want to just stress that kind of moderation, variety, synergy. I mean, we have to live our life. We need to have fun. We need to enjoy ourselves. We just need to find the balance and use moderation. And balance applies to everything from food, hormones, lifestyle, exercise, stress, and weight. And we have to be able to enjoy some birthday cake, glass of wine once in a while, but you know, every day or many times a day definitely causes us harm. So my top 10 for breast cancer risk reduction: optimizing your vitamin D levels, avoiding those processed oils. I recommend cooking with avocado and coconut oil, and then flaxseed oil or olive oil on your salads. Try and buy organic and non-GMO if you can. Limit your alcohol. Try and maintain appropriate body weight. Get some moderate exercise in. Avoid the added sugar as much as possible. Stress management becomes really important. I think that's one that we tend to ignore, or we just don't have time for it, but we have to learn to take care of ourselves and really manage that chronic stress. My top 2 foods really are the cruciferous vegetables and the onion, leeks, and garlic, based on that one slide that I showed you that showed they are so powerful against anti-cancer. That's it. Thank you for listening and joining me today.